I'm Dr. Rachel Miller, physical therapist, and today I want to show you a posterior pelvic tilt. It's a great exercise if your spine likes lumbar flexion, so think child's pose, if you have stiffness in your low back, or if you need to wake up those lower abdominals after a lower abdominal surgery or something like that. This is a really lovely way to start fine-tuning not what you're doing, but how you are doing it. So if you've ever laid on your back before and done a pelvic tilt, which is this motion, where I'm pressing my low back into the floor. So try that if you want, and just notice what usually happens. It's usually the legs that are pressing into the floor, and it's the glutes that then go into that posterior pelvic tilt, which there's nothing wrong with that, but we're kind of skipping over the whole center of our core, assisting with that motion. So I like to teach it a little bit differently. So I'm going to scooch down, and what I usually recommend is finding a couch or a chair or something where you can just put your legs up that's not going to roll away on you. So my legs are supported in what I call almost a supported shelf. So knees are bent, it should be fairly comfortable. And now my legs can't push. My legs are just taken away essentially. And I think about my tailbone being the leader. So if we think about the base of the pelvis, the tailbone's at the bottom, and I'm going to try to flick my tailbone up towards the ceiling. So I'm not moving my pelvis, I'm not moving anything externally. It's literally just this little tiny tailbone flick, which is essentially a pelvic floor contraction. When I lift my tailbone up, my pelvic floor lifts and contracts. Then from there, I'm going to think about my pubic bone lifting up towards my chest, and my lower abdominals are going to be what activates to press my low back into the floor. And then I inhale and I just relax and release. So I think about exhale, tailbone to pubic bone to chest. So it's pelvic floor first, lower abs second. I feel a lot more ab work, and my legs and my glutes aren't doing anything. So this motion is really nice because it starts to strengthen and wake up those lower abdominals and starts to create mobility in that lumbar spine. So it's a really nice kind of easy activation exercise. And then eventually when you have your feet back down on the floor, you still want this to happen first, and then you can add that glute activation if you're going and progressing into a bridge or something like that. So give it a try, see if you can start to find and feel some lower abdominals helping out and your pelvic floor helping out as well, because that's that deep inner core that should be working more for many of us in real life.